So here's the topic that a lot of our viewers, that a lot of you think is a hot button issue. Should the unvaccinated be taxed? They're already doing this in Quebec, imposing a health tax on unvaccinated Canadians. It's to cover the additional costs that the unvaccinated are putting on their healthcare system. So a little closer to home, Joy Reid is also calling for the unvaccinated to pay more. Take a listen to what she had to say.
Let's talk about what other countries are doing, because at some point, I feel like people who are willfully unvaccinated, fine, don't get vaccinated. But they need to start to pay a little bit more of the cost of what this is doing to our system.
So it's important to note, though, and I want all of our viewers to hear this, that there are exemptions being made for those who have medical reasons to not get vaccinated. So if that's you, we're not talking about you here. DBL Nation, gotta hear what you have to think. Should the unvaxxed be taxed? Go to dblvote.com to weigh in. And okay, so let me start with you, Erica. What do you think about this? You just came back from Canada.
Yes.
I know it's hard to compare the two healthcare systems,
right,
but just in general, paying more.
Yeah, I did want to say, because anytime you say tax, and of course Canada has universal health care, we don't have that in the U.S. So those are two different things. But I don't really see the issue with people who have opted not to be vaccinated being charged more. There's a precedence for this. You'll remember back in August, we talked about Delta Airlines charging additional $200 a month for any employee who decided not to become vaccinated. And the reason why that they quoted was that it costs each person who has a hospital stay due to COVID $50,000 more. So the idea that if you smoke and you check that box, you have a higher premium, it seems to be the same thing because you're at higher risk.
Interesting. What do you think, Jeff?
This is interesting. I think Erica points out a very great point that this is Canada, not the U.S. We have two different systems, so now we're just talking in general here. I think we have to be specific about that. But we're going down a slippery slope when you say let's tax people who don't want to do this for health reasons. I understand there's underlying conditions for other people, but are we going to start taxing people who choose to be obese that don't have an underlying condition because they are causing more problems in the hospital as they get older? Are we going to have a tax on the elderly because they're spending more time in the hospital? It's a slippery slope when we talk about taxing people. I understand cigarettes and alcohol are taxed more, and if you smoke, you got to pay more on your insurance. That makes sense, and this is going down that similar road. So I see reasons for both on this.
Al?
And Jeff, I think the reason you see reasons for both is because I think as human beings, we're taught to look at things from both perspectives. We're looking at things from, an emotional perspective, like, is that right? Is that fair? And then we're looking at things from an economic perspective. And I make this analogous to the plane seats. If somebody is obese and they buy one plane seat, but they are using up more resources, meaning that they are imposing on somebody else's seat, the question has always been, should they pay for a second seat? That's an issue for another time. I'm just saying, when somebody's using up more resources than the funds that they have put forth have allotted, we are at least allowed to question and play around with the idea of charging you more. If you go to a restaurant and you order a very specific fancy meal that takes the chef that's making a lot of meals away from his job to work on just your meal, you should be charged more.
Well, let's talk about some of the statistics, though, because for me, the statistics help put things into what direction we should go as a nation. So as far as in Quebec, 50% of the ICU beds taken are unvaxxed. As far as here in America, if you look back in July, 90% of COVID patients were unvaxxed, and those were the ones taking up all the ICU beds. We heard a number of stories of people saying, my dad had a heart attack. He couldn't go into the ICU because there was no beds for him. I have someone else that I know that had lymphoma. They weren't able to use a ventilator because the ventilators were taken up at a Boston University hospital. So it does become personal if it's one of your family members who aren't able to get a hospital bed because they are taken up by a preventable, at this point COVID is preventable, not by contracting it, because we all know that there's breakthrough cases with the vaccinated, but it is preventable when it comes to death and severe ICU illness. And then more recently, other sources have dropped that number to 70%. I think something that we're not talking about is healthcare workers. My brother-in-law, not Eric, who lost his life to COVID, but my other brother-in-law, JP, is an ICU nurse. He's done. He's over it. So are all his colleagues. For so many months, they were held up on a pedestal as frontline workers, good for them, yay. And then all of a sudden, they're being questioned by their patients. Why are you giving me this? Not giving me this. Why can't you give me ivermectin? Blah, 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 blah. These are our healthcare workers who have studied along with their doctors, who know everything about COVID, have seen deaths, have had to call loved ones, and all of a sudden they're the enemy. And they are at their wits' end. So something has to turn this tide in Quebec. This is working. They've seen a big increase in, I'm not trying to go on a big monologue, I apologize, but I just want to give you guys the facts. In Quebec, they've seen an increase in their citizens getting that first shot since they've been taxed. So maybe hitting people at the wallet is the right thing to do.
Well, the other thing is, you said 90% of people in Quebec were vaccinated. But also, like, some things that people aren't considering is, like, you know, I have family in Canada. We were very in a privileged position being in the U.S. because we had access to the vaccine far before my family in Canada had access to it. And when they did have access, they had originally AstraZeneca. So now they're doing other things in order to boost and make sure that they are fully vaccinated. It was the access. And remember back in the day, a year ago, when everyone was like hoping to get access to this and people were clamoring, and now all of a sudden people don't want to do it and they're rejecting the vaccine, and the vaccine is so plentiful in this country. There are other countries where the vaccine is non-existent.
Yep.
So when we're having this conversation, I just always want to remind people, and I'm not one, I know that some people feel differently. I am not one to be like, you need to do this, you should do this. Because I know that if I say that for someone who has their reasons for not getting vaccinated, that's only solidifying their stance on it. But I will say this, why are we hoarding vaccines from the rest of the world? I mean, why are we doing that? That's like literally being in front of starving people and being like, I'm going to eat all of this food and then I'm going to throw the rest of it away because it's my food and it's up to me if I'm going to eat it or I'm going to let it rot, although you're starving. That's the thing that blows my mind. Like, if people have made their decisions, okay, they've made their decisions. Why don't we make these vaccines accessible to other countries who are really asking for them, who really need them?
That's a great point. Jeff, I heard your kids trying to chime in. They want to get in on the conversation too.
I apologize about that. I don't know what's going on today. They're going crazy. And then when we're trying to have a serious conversation, they're screaming and it doesn't make it look very professional. So I apologize for that. But I do appreciate getting back to what we were talking about, what you were saying, Sam. I don't think you were going on a rant. Erica, what you were saying. I think this is a conversation that we could almost do a whole show on, right? Because there's so many different avenues. It's so diverse. And I think that's the way Americans are starting to think. We're being fed by the media that a one-size-fits-all remedy for everything, whether it includes beds, medicine, vaccines, whatever it is. And that might not be the case anymore. So I think we need to put this on the table, talk about different avenues a little bit more, not about the vaccines, just about different options for people who aren't vaxxed, are vaxxed, moving forward. There's so many different avenues to cover.
That's a great point, because at the end of the day, if everyone feels heard, they're going to be more open to finding some sort of a compromise to protect everyone, right? So I love that, Jeff. And don't think it's unprofessional. It's real that your kids are noisy in the background. That's a working dad for you.
Everyone in our audience is dealing with that. So yes, it's very real.
Exactly. Well, I'm so appreciative that we can have these conversations on the show.